Good afternoon. I'm at that time which we're about an hour and a half after lunch and a little bit before coffee, so I know everyone's feeling a little tired and starting to nod off, so hopefully I'll be able to grab some attention. I first want to thank the committee for inviting me to be here, and I have been asked to talk about family-focused interventions to prevent bullying. And the first thing I want to say is that there are no family-focused interventions that are specifically focused on bullying, which could be the end of my talk, and we could all go have coffee and talk about why that is. So I study aggression and violence more generally, and kind of bullying on the around the edges. And I've been thinking about this now for a couple of years. Why is it the case that so much of the work in other areas of violence is focused on family, and so little of the work in bullying? And I don't have the answer to that, except that I think so much of it is about the fact that we think about bullying as something that happens in school. So I think schools have gotten the burden, essentially, of trying to deal with the problem of bullying. But we all come from families. Many of us have families. And the developmental literature would suggest that family is one of the most important developmental influences on our behavior. So I'm here in part to argue for an increase focused on families as we move forward in this work. We can think about the role of family in three different areas. Talk about family as risk, so what's happening within the family that increases risk for children to perpetrate bullying or be the victims of bullying. Think about family as managing the contextual risk, the risk that's in the context. How do families help manage the contextual risk of schools or the contextual risk of neighborhoods? And then think about family as more generally protective and promotive of more healthy kinds of behavior. So as I said, there's been relatively little work looking at family factors, both in terms of prevention, but also at family factors that are related to increased risk. But the work that has been done generally falls within three lines. Those youth that live in families where there's violence within the family, both intimate partner violence, violence between parents, between domestic partners, or experience child abuse and neglect, are at significantly increased risk for being bullied. And the mechanism through which people theorize that's the case is that this is, again, a differential power situation, that parents are more powerful than children, and a modeling of that form of control or violence. The second area is around what we commonly talk about as parenting practices, so harsh or coercive discipline, harsh discipline not to the full force of child abuse and neglect, but certainly inconsistent or harsh practices, and also poor parental monitoring, so not knowing where your kids are, how they're spending their time, who their friends are. And when I started in this field about 20 years ago, these were the two aspects of parenting and family functioning that most of the research and most of the preventive interventions were focused on. And I think more recently we're learning, and the research in bullying would suggest that there are other important aspects of what's happening within a family that I think look particularly relevant around bullying prevention, such as the level of hostility within the family, conflict within the family, and in particular, an absence of warmth or personal connection to one another. In our data from inner city youth and families, we find that the absence of what we call emotional cohesion or warmth puts kids at particular risk for violence. So even when families are doing those kind of discipline things well, discipline and monitoring, that lack of connection to people within the family seems to be particularly important around perpetrating aggression and violence. Family as risk for victimization, we know much less about, even less than as perpetrators of violence. But the two kind of broad areas of family functioning that seem to come out are families as being kind of overprotective. The family therapy term is enmeshed. And those that tend to be conflict avoidant, so that children aren't able to, they don't have the opportunity to learn to manage conflict. Part of what's difficult about this area in particular is that studies don't disentangle the transactional nature of the relationship between parenting and those child behaviors. So it's hard to know how much is it about a parent has become overprotective because the child has been victimized versus that kind of overprotection relates to a child being more vulnerable and more likely to be victimized, or is it really probably more likely the interaction between those two things? So, as I already mentioned, as we've talked about, the overwhelming majority of bullying prevention interventions are school-based. There are very few, none, that I could find that were specifically focused on bullying. But as has already been mentioned, parent training is sometimes a component of those school-based interventions, with most of those focused on children as victims or bystanders. So giving parents information about what to look for around victimization or how to help your child thinking about as a bystander, and surprisingly less around perpetration. So I won't go into the systematic review. It's already been mentioned a couple of times, but in the Farrington systematic review, one of the things that stands out in that review is that inclusion of parenting training component was one of the program elements associated with the greatest decrease in bullying and victimization across those studies. And there was a parent training component in 11 of the 30 programs that were reviewed. And digging into those programs to try to understand what it is, what's actually going on in those parent training programs, you'll find that it's actually very little. For the most part, what is involved in those parent training programs tends to be kind of informational handouts, or 2 or 3 parent meetings where parents are brought together to have a speaker on bullying and giving information about the nature of the problem. And for those who have ever tried to do family-focused interventions, you might guess that the take-up of those kinds of programs is actually very little. So in most of the studies, because the information was provided primarily around the school-based aspect of the program, was very hard to figure out how many parents actually and what percentage of parents actually participate in these types of programs. But generally, the rates are very low. 10% of families might show up at parent meetings, and previous research would suggest that those tend to be those parents of kids who are at lowest risk for being involved. That said, even this very, what I would say, light touch kind of parenting family component seem to be important, which suggests to me that, a greater focus on parenting and family might be something that could help us move the dial a bit more. So I put this list up here again because if I were giving a talk on family as a risk for aggression and violence, I would have this exact same list of factors up here. It turns out that these are the same things that are going on within families that relate to bullying, as relate to aggression and violence more generally. And so while very few studies that are family focused, that look at aggression and violence more generally, have focused specifically on families, it seems very likely that this growing evidence base that we have around family-focused interventions in the areas of aggression and violence could very likely be applied to bullying. So from that larger body of research, in aggression and violence more generally, what we've learned is that there are a number of things that we need to do in families, to work with families to be able to move the dial around aggression and violence. And none of this will come as any surprise to anyone who is a parent or has been parented. But nurturing parenting skills, that basic discipline and monitoring, focusing on stable family relationships, again, highlighting this emotional connection to each other, to people within the family, clear communication, feeling a level of support. Supervision and monitoring of children, knowing where your kids are, knowing who their friends are, knowing the parents of their friends, knowing what's going on in school. Parental involvement in school, which has been surprisingly difficult to negotiate. It's very something that perhaps we can talk a little bit more about in the discussion, but certainly in the schools that I work in, parents don't feel particularly welcome, and I think that is something that I hear regularly, not just in inner city schools in Chicago, but in other places as well. But that we also need to work to connect families within neighborhoods to one another, so that they can get information from one another and they can have a better sense of what's going on and connect families to greater social support. So I'm going to talk just a little bit about a couple of family-focused interventions that I've been involved in over the last 15 to 20 years that have been focused on decreasing risk for aggression and violence, and we have some evidence that these probably have an impact on bullying behaviors as well. Two programs, Safe Children, Schools and Families Educating Children, and Great Schools and Families, and don't ask me what GREAT stands for because I can't remember. Both of these are based in a similar conceptual model, in that we're working to build protection through the things that I just talked about, parenting skill and quality of family relationships, parental involvement in school, building a network of social support. So both of these interventions are delivered within multiple family groups, putting 4 to 6 families who live in the same neighborhood, whose kids go to the same school together, so that we can build these informal networks of social support. And working focused on managing the social, ecological, and developmental challenges within schools and also within neighborhoods, with a focus on decreasing aggression and violence, but also promoting academic achievement and positive youth development. They're focused at 2 critical developmental stages. Safe Children is focused on, it's a universal intervention for all kindergarten and first grade kids as they're entering school to help give kids a good start to school. And then Great Families is focused on 6th grade middle school youth, that transition to middle school. Great Families, the other difference is that it's focused on high-risk youth, and in the initial evaluation, high risk was defined as those who were already involved in aggression and problem behavior, but not just those that were involved in aggression, focusing particularly on those that were rated by peers and teachers as socially influential. So we weren't necessarily looking to impact the aggressive kids that no one likes, but we were hoping to try to move the dial by working with the most influential youth in the family. And I'm out of time, so quickly I'll just say for Safe Children, again, this is a program that works with families of first grade students. We found in high school 50% reduction in serious reports of serious misconduct, including bullying, 33% reduction in school reports of violence, and a 20% increase in being on track for high school graduation. And for grade schools and families, we found an evidence not only of impact on those kids and families who were in the program, but an ecological effect in the schools where the sample received the intervention. So, so we found a change in not just individual level violence, but school level violence. Suggesting that an intervention with this particular group of high-risk youth who are socially influential can affect overall aggression. There are a couple other examples of evidence-based interventions, and thinking ahead, some questions for future research, whether or not there are specific relations between aspects of family risk and different types of bullying and victimization. Relatively little of the bullying research, particularly around families, has looked at ethnic, racial, and contextual differences around family risk. Again, looking at whether or not the impact of existing evidence-based family-focused interventions might also have an impact on bullying, and thinking about the developmental timing of interventions to impact bullying behavior. And I'll stop there.